preparing for COVID-19, implementing FollowMyHealth Telehealth quickly and easily. In this session, we will hear from Skylar Wasson, the Director of Product Management for FollowMyHealth. With the coronavirus outbreak and the recent lifting of Medicare restrictions regarding telehealth video visits, FollowMyHealth has developed a specialized plan for clients to swiftly implement telehealth at their organization. And now to our presenter, Skylar Wasson.
Good morning, everybody. We appreciate you joining us. I just want to reiterate that we're going to focus today on the functionality around the coronavirus outbreak. All the telehealth stuff that we're going to cover is actually available for use with other conditions or diseases if you wanted to leverage it. It's all available today. So go ahead and share my desktop and we'll dive right in. We got a lot of ground to cover. So we're going to just give a brief overview of the features, a demo of the functionality that we're recommending people use to help combat the spread of coronavirus. We're going to talk about the requirements in order to actually implement these features. We're going to touch on the Medicare reimbursement changes that have happened recently. We're going to highlight the streamlined implementation, and then there's some additional recommendations that we have that you could use FollowMyHealth to help with coronavirus in addition to the telehealth features, and then we'll talk about next steps. So we really have three different flavors of telehealth in FollowMyHealth. The first one I'm going to touch on we call email visits. So this is basically setting up a form that the patient's going to fill out. You have complete control over the questions that are available in that form. You can do branching logic. You can really customize it to kind of behave however you want. The patient will fill out the form based on the chief complaint that they choose, and then we're going to bundle up that information from that form along with their preferred pharmacy and callback number and send that back as a secure message back into the EHR. That's going to allow somebody to then triage and review it. We have the option to add attachments, so the patient can snap a picture of something with their phone or upload a file from their desktop and include that with that secure message. We can optionally turn on out-of-pocket payments, so the patient can put in a credit card at the end of submitting it to pay a flat fee out of pocket for using the service. This is one of those features that we're recommending you don't use for the expedited implementation because it takes time to set everything up with the merchant and the vendor for the credit card collection. So it's something that you'd come back and easily add later, but it is an option, so we do want to mention it. The provider can then review that along with the chart in the EMR. They may also have somebody triaging it for them and then forwarding it to them after they've done that. They're going to document like they normally would within the EMR, and then they're going to respond back to that patient and FollowMyHealth with a secure message. And all of the chart notes and prescriptions and other stuff that you document in the EHR that normally flow into FollowMyHealth would do so for an email visit as well. So that's one flavor. The next piece that we have is our scheduled video visit. So you're actually going to meet with a specified provider at a specific date and time. The patient's going to connect virtually, and the provider is also going to connect virtually. These can either be scheduled by your organization directly in the PM system, or we even support direct scheduling on the patient side. So if you wanted to set that up, they would be able to select the video visit time that works best for them and book it directly in your PM system. The patient's going to check in. They're going to enter their preferred pharmacy and their callback number. We can optionally include images on this as well. The provider is going to sign into the FollowMyHealth dashboard where they'll be able to see their schedule, see who's checked in, and they can join the visit from there, review the attachments, review the other information that was collected. They're going to document in the EMR like they would for an in-office visit. And then all that information is going to flow back into FollowMyHealth for the patient in the way that it would for an office visit or an email visit. The third option that we have is kind of more like remote urgent care. So we call it on-demand video visits. You can specify office hours that this feature is available, and then the patient can meet with the first provider that's open. They basically get in a queue and they see that first available provider. They're going to enter their preferred pharmacy and callback number when they're checking in. They can include images. We can also do an out-of-pocket payment from the patient right then. We can text notifications to the provider when the patient joins the queue. So maybe you're leveraging this after hours and someone's on call. they'll get a text message when they need to jump on and see a patient, so they don't need to sit there and refresh the queue from their computer all night. The provider's going to log into the dashboard again, join from there. They'll document in the EHR like they normally would, and all that stuff's going to flow into FollowMyHealth in the same way that it will for email visits and scheduled video visits. So I'm going to jump into the system real quick and walk you through what this looks like. So I'm going to log in as a patient, and in this example, she has a follow-up appointment in person tomorrow morning. Now, we have set her an appointment reminder, and we also set up a pre-appointment form for screening for coronavirus. The intent of this is to capture anybody that's got symptoms before they show up in person and direct them to use hopefully one of the telehealth services or some other option in order to prevent them from coming into the office and infecting other people. One of the things that I've done is updated the appointment instructions on the in-office visit for the follow-up. You can see down here that we've just added a blurb about experiencing potential coronavirus symptoms and what we want you to do if that happens. So this is directing the patient to call in beforehand. So this is an option that would be available to you to leverage that's part of your existing FollowMyHealth implementation today. I'm going to go ahead and pull up the form now and fill it out. So this first little page with question is pretty basic. We're just kind of letting them know what we're doing and why. You can fully customize these questions. You can change the wording on here if you choose to do so. This form will be available for you to download and then upload into your dashboard so you can plug it right in and start using it. And everything in here is based on the CDC recommendations and has been reviewed by our clinical staff. So it's based on the current recommendations now. Those have been changing pretty quickly, so we're expecting some of the questions in here to probably be updated, you know, in the next few days, the next few weeks, but you guys can tweak these if you want to. So this first question, we're just asking them if they have any of the symptoms that we're looking for. If they say no, great. Everything checks out. We'll see you as scheduled. Looking forward to you stopping by. If they answer yes, we're going to start asking them some additional information. So, okay, of those symptoms, what symptoms have you had? So I'll just check fever and cough. Have you taken your temperature? I'll go ahead and say yes. What was the last temperature? I'll throw in, you know, 101. Have you traveled internationally or domestically? And you can, you know, answer yes or no to that. I'll go ahead and say yes, and that I traveled to another location, and we'll do California. And then there's a question in here about whether or not you've been exposed to anybody that has coronavirus. I'm going to say I'm not aware of that. And then we're giving some specific instructions here. So this text can be updated. Right now, we're just recommending that, you know, they take various precautions for washing their hands and wearing a face mask, et cetera, when they come into the office. You could direct them to use one of the telehealth features here. Maybe you want them to convert this in-office visit to a video visit instead. Maybe you want them to call the office. You can really customize this based on whatever protocol you want the patient to follow. So I'm not going to send this in. I'm just going to close it out now. But if I did hit send, it's going to bundle all this up and send it back as a document back to the EHR, so that can be reviewed from there. And then hopefully the patient will take the action that we've requested that they do from that form. So the next piece I'm going to demo is actually the scheduled video visit, and I'm going to show you what that looks like with the patient actually scheduling it. So in this case, I've got a specific appointment type that I set up here for suspected coronavirus. You can customize what you want to call it. You can customize the description for when to use this appointment type. You could just have it be a sick visit if you want. It just kind of depends on how you want to leverage it. So I'm going to go ahead and select this and hit continue, and then I'm going to choose my normal provider, James Peterson. And then I'm going to look for the next available appointment, and the first one that we have is available at 2:30 p.m. today. So I'm going to go ahead and hit continue on that. And then I'm going to just put in a demo for this. As the appointment reason, I'm going to schedule that. So that's going to book that directly in the PM system. It's going to give me some instructions here about what's expected for the virtual visit to happen. It's going to recommend that I download the mobile app if I don't have it already. That's our preferred experience for patients using video visits. It's very simple because all the devices for the camera and the microphone and the speakers are integrated really well with the mobile device. You don't have to choose the right camera or your speakers, so it should be pretty simple for somebody to just log in and tap on the visit to get connected. It's going to be a lot more like FaceTime works on the iPhone as opposed to like using WebEx or something from a browser. So I'm going to go ahead and close that, and you can see here that visit has shown up now, and it will open up for me to check in 15 minutes before the visit start time, which is actually at 2:30 today. So the last piece I'm going to touch on is our on-demand visits. So I'm going to go ahead and start one of those right now. You get to set up the office hours for when this is available. As patients join the queue, we keep track of when they join and how many are there, and you can figure out how long it's going to take for the patient to likely be seen based on the average visit time for your video visits. So in this case, there's nobody ahead of me in the queue. It's giving me an estimated wait time of 0 minutes. If there were a few people ahead of me, it would adjust, 8 minutes, 15 minutes, whatever you have it set to for your average time. So I'm going to go ahead and select that, and then I'm going to go through the check-in process. There's some things to know about the visit here. This is customizable text. You could include information here about coronavirus and what you want people to do. So I'm going to go ahead and click next on this. It's now going to check my camera and my microphone and my audio and make sure all that stuff's working on my device and everything's checking out. So I'll go to the next step. I'm going to choose my reason for visit. You could add something here for coronavirus or flu, cough, fever, whatever you want to call it, it's available for you to do that. So I'm just going to grab the cold one. I can enter some additional information about my visit here. I can add those attachments if I need to. I can go ahead and pull those up and grab something from my computer. Just going to go ahead and grab a picture from here to show you what it looks like. So just uploads it. And then hit next. If the organization needs to call me, what's the best number to call me at? If they need to write me a prescription, where do I want to go? And then I'm going to jump into the virtual waiting room. And now Jessica is going to help be the provider here. She's going to actually join the visit and sort of show you what it looks like when we transition into that video conference. And I can see myself, and as soon as she joins the video, I'm able to see her. We've got a little bit of feedback because we're on the audio on my computer and the phone, so I'll just mute that real quick. We have our video conference. Her view is basically going to be the same. She's just joining from the dashboard, and she'll be able to view the attachments and see the other information that was collected. We have our conversation, and then she'd be documenting in the EHR. When everybody's done, we just hit end visit, and off we go. You do have the capacity to leave the visit and come back either as the patient or the provider. You could set this up so that you have a nurse or somebody triaging patients as they're entering the queue and then adjusting sort of the order that you see them in potentially or, who they need to see. So you have a lot of flexibility there. I'm going to go ahead and end this visit, and then the last piece I'm going to show you will be our email visits. So we actually created a special form, which is similar to the pre-appointment form that we went through. In this environment, we've got our email visit set up to charge $49. You can turn this on or off. Again, we recommend waiting on doing that piece for the expedited implementation so you would be able to get this set up faster. I'm going to go ahead and hit next. And then I'm going to choose the new coronavirus screening form. Now, this is something that a patient's going to be making the decision that they think they might have coronavirus and want to fill this out, as opposed to the pre-appointment screening that we did before, where everybody that has an upcoming office visit will be filling out that form, whether or not they think they have coronavirus. So in this case, the questions are going to look really similar, and I'll go ahead and fill them out. Same deal, fever, cough. Have I taken my temperature? Yes, I have. What was the most recent reading? I'll go with 101 again. I don't know why it's doing that. I think I have a bad version of the form installed. Have you traveled, internationally or domestically? I'm going to say no. Have you had close contact with anybody that you know has coronavirus? No. Any other details we want to add? And then they can go on to the next step. In this case, based on how I answered the questions, we're going to give you specific instructions about a suspected coronavirus case and what to do. You can fully customize this if you want. You could direct them to call your office at this point. It's really up to you. And then I'm going to hit next. Attachments again, it works the same way as what we showed before. Preferred callback number and pharmacy, we always capture that. And then the last step is to go to the payment page. If you had this turned off, it would just submit the email visit at this point and send all those details to the EHR. In this case, I can launch the payment page and make a payment there if I choose to do so. So I'm going to jump back into the presentation and kind of walk through some of the additional details that we want to cover. I'll start with the requirements to use telehealth. So we've got these split up by feature. If you want to use email visits, you're going to have provider messaging enabled, and it needs to be supported with your EMR integration. So if you have direct integration with secure messaging today with your EHR and your system supports different message types, you would be able to leverage email visits. Or if you're using the provider mailbox from the FollowMyHealth dashboard, this is also an option that's available to you. Email visits are not available today with Paragon Secure Messaging. You could theoretically switch over to use the provider mailbox with that integration. However, that means that all secure messages that are coming from FollowMyHealth today would instead be routed to the provider mailbox, and your providers would have to log into the dashboard to see those as well as the email visits. Attachments are supported with TouchWorks 17.1 and up, Pro EHR 17.0 and up, and with the provider mailbox in FollowMyHealth. If you want to use scheduled video visits, there's a couple requirements with our integration with your EMR and or PM system. We have to be able to sync appointment types into FollowMyHealth and appointments as well. You're going to give providers access to the dashboard. You can control it so they only have access to the telehealth schedule. They'll be able to see their appointments. They'll be able to see who's checked in. They'll be able to join the visit from there. This functionality is supported with Sunrise version 18 and up, with Paragon version 15.0 CU2 and up. There's no minimum requirements for TouchWorks, supported for all versions, same with Professional EHR. And then if you have a third-party EHR and or PM system and you have appointments and appointment types integration, i.e. direct scheduling is available for you, you shouldn't have any issues doing scheduled video visits. I do want to call out that Professional EHR version 18 and up has direct integration with scheduled video visits. So when the patient joins and checks in, we actually update the status to show that they've checked in. You'll see that in Pro. And then when you open up their record and go into that encounter for that patient, there's a button to join the video visit, so you don't have to actually log into the FollowMyHealth dashboard to do that. In terms of on-demand visits, there's not any direct integration with the EHR, so this is going to be available for every client that has FollowMyHealth implemented. You're going to set up providers with access to the on-demand queue from the dashboard. They'll be able to log in there, see the queue, and join those visits. In terms of the technical requirements on the client side, we're leveraging WebRTC for the video conferencing, and it's going to be supported with Chrome, Firefox, and Apple Safari. You can also use it with IE 10.0 and later. It requires a plugin to do that, and IE has been deprecated by Microsoft, so we recommend you go with one of the other options. Chrome is usually the one that works the best for people. In terms of the system requirements, you have to have a computer, you have to have a microphone and some speakers. There are a few different options that we've tested with and recommend. This is all functionality and information that's available from the patient access guide. The dashboard guide for FollowMyHealth if you want to peruse that. We do need to call out that the browser is going to need access to the video camera, the microphone, and the speakers on the device that the provider is using. So if there's any issues getting that to work, you're going to have issues with video visits. The way that the call quality works is it automatically adjusts based on the connection speed. So as the bandwidth goes down, the resolution of the call will go down, it'll become more grainy, and eventually it can just drop down to even audio only without video if the connection speed is too low. We recommend that people have at least 1 megabyte per second down in order to have a good experience with the video conference, and that they should be using LTE or Wi-Fi as their connection. The faster the connection, the better off they're going to be. So we also recommend that patients are home or on LTE when they're joining it. You're going to have to open some network ports and whitelist a few IP addresses on your side in order for the video conferencing to work through your firewall. And then we do want to call out that video visits are available from the dashboard for providers, but that is not supported on tablets or mobile devices for the provider. It is supported that way for the patient. So one additional thing to call out is that the patient has to be connected to your organization with their FollowMyHealth account in order to access these features and join the video conference. That helps us make sure that we know who they are. It helps with security. It makes it easy for them to not have to download a separate app or create a separate account. But it does present a challenge for folks that don't have a FollowMyHealth account yet that want to use this feature. So we recommend in that case that you're set up to send manual invites and help with the onboarding process, and then direct them to use the appropriate features. Patients have the same basic requirements in terms of the call quality and speed for their bandwidth. And then when they're accessing it from a browser, it's going to be the same requirements that we had for a provider, but we do recommend that patients use their mobile device, either Android or iOS, with the FollowMyHealth mobile app for the best possible and easiest experience. All right, just a quick point on Medicare reimbursement. So Medicare is now covering telehealth visits related to coronavirus because we've declared a state of emergency, and that funding is good through the end of September of this year. There's an additional link here if you want to learn more about that particular bill, but wanted to call out that the government has made some changes to cover reimbursement for using this functionality. Some other recommendations that we want to hit on. So a big part of this is letting your users know a little bit more about coronavirus and what to do if they think they have it. Where should they go? What features should they leverage? So you want to make sure that you're putting that information in front of them where it makes sense. So we demoed the appointment instructions, having some details on there. You could also update your appointment reminder templates to include some information on that. If you're experiencing fever, cough, or shortness of breath, please call this number before you come in for your appointment. You could also do the same thing with the invite templates or the health record update templates. Those are available for you to edit from the dashboard. For external sites, you might want to put some details on the features and things that you offer on your website and direct people to create their FollowMyHealth account and get set up that way. If you're using PayerPath, we can actually insert a flyer about the telehealth or other actions that you want the patients to use to get that information in front of them that way. We created that pre-appointment screening form for in-person visits. That's available for you now. Even if you don't use the telehealth features, you can just plug that in for your in-office visits and leverage that to direct patients to different modes of treatment depending on what you're using. It's a good idea to leverage the bulletins that we have to send out just general information about coronavirus and then specific instructions on using these new features when you enable them. For example, you might decide to just use on-demand visits and that's it, or maybe just scheduled, or maybe just email, or all of the above. You would want to let your users know through the bulletins what to use and when to use it. It's also a good idea to review your auto-invite process and make sure that you're sending those when you should be. Make sure that folks on your staff know how to onboard patients to FollowMyHealth, know how to talk about it, so that you can get people in that system quickly. And then, of course, we have level 1 patient support that can help with questions and things once those invitations have been sent. So you're welcome to leverage that if you choose to do so as well. All right, so on the implementation front, the whole goal here is to get you up as quickly as we can so that your patients can start using these features to help deal with the spread of the coronavirus. This is going to include a decision workbook and 10 remote project hours, as well as the email visit form and the pre-appointment form for COVID-19 that we just demoed. This initial implementation is just really designed to get you started so that you're ready to go and you can start working with it. But there's a lot of other functionality that you may want to leverage after the fact. And that could be for coronavirus, or it could just be leveraging the telehealth features in general. So you want to start thinking about how you would do like appointment requests or direct scheduling or upfront billing. We can circle back with you in a few months or a few weeks and help you get that set up. You don't need that out of the gate to be ready to help deal with the coronavirus epidemic. We're going to put more information on our about.followmyhealth.com site. We'll be sending out a link to that. It's going to have the forms there. It's going to have like the how-to guide. We're trying to get you guys as much information as we can so that you can get this implemented quickly. So in terms of next steps, you can go ahead and contact your sales representative or your AOE, or you can email sales@followmyhealth.com. We can get you a demo and start talking with you more about what an implementation would look like and get you through that process quickly if you choose to go that route. All right, so with that, I think we can open it up for questions.
Yes, thank you, Skylar. So just a reminder, if you have any questions, please put them in the chat box on the bottom right-hand corner of your screen. And then we will answer them. So we just have a few minutes left, and I'll start with the first question. Does this work with any EMR?
So it'll work, most of it will work with Allscripts EMRs. We went through those slides that laid out what versions were available. If you have a third-party EMR, you can reach out to us and let us know what that is, and we can let you know if it'll work. There is some variation between the different systems and the integration level that we have with them, and so we can just kind of take that on a case-by-case basis.
Okay, perfect. And then how can I see more of this provider experience?
So being that the demo was only 30 minutes today, we didn't have time to show that. That's something that we can show you if you wanted to do a closer demo. We could maybe record some additional pieces and post it on the about.followmyhealth.com site that I mentioned as well, so we can make sure we get you that information. If you do need to see more, just reach out to your AOE or your sales rep, and they'll be able to take it from there.
Okay. I have another question. Where does the provider see the patient messages, et cetera, in Paragon and Sunrise?
So in Sunrise, it's secure messaging, and in Paragon, it is the messaging area of Paragon as well. So we have direct integration with Paragon and secure messaging today. What we can't do is actually split the message types between a regular secure message and an email visit today with Paragon.
And then I have one more question. How does the patient pay for a visit? Is there a page for entering a credit card, insurance number, FSA, et cetera?
Yeah, so the email visits and the on-demand video visits have an option to capture payment from the patient when they go to use the service. And this would be the patient paying with a credit card out of pocket. I did not show that window in this flow because we aren't recommending that you start with that for the expedited implementation. You can also bill after the visit. So you would drop charges from your encounter like you would for an in-office visit, and then either bill the patient's insurance company if they cover that service, or you would send it to, bill the patient. And you could even leverage invoice billing in FollowMyHealth and have the patient charges show up as an invoice and be paid that way after the fact like you would for an in-office visit.
Thank you again, Skylar, for your time in this presentation, and thank you for everyone for joining. This concludes the webinar.